African Americans have health disparities. Young African Americans are getting heart disease, diabetes, and stroke. African Americans' ability to prevent and treat certain conditions is influenced by socioeconomic factors more than genetics. Here are the top 7 diseases in American African. 1. Heart disease. Heart disease kills most Americans. Since the 1970s, heart disease rates have steadily decreased among white Americans but not among African Americans. The data shows that African Americans have a lower chance of surviving a cardiovascular event than other populations, not that they have more heart disease. African Americans 18 to 49 are twice as likely to die of heart disease as other Americans. The Affordable Care Act gave all Americans health insurance. Access to cardiac care has improved for African Americans, but disparities remain. This population receives cardiac catheterization referrals later than Caucasians, resulting in worse outcomes. 2. High blood pressure. High blood pressure is a risk factor for developing heart disease. This condition, also known as hypertension, causes African Americans the most difficulty. In fact, high blood pressure affects 1 in 3 African Americans. Without adequate access to care, managing high blood pressure is challenging. African Americans are less likely than non-Hispanic Caucasians to have their blood pressure under control. African Americans also experience much higher blood pressure levels and develop high blood pressure earlier in life. 3. Cancer. African American men are 50% more likely than white men to get lung cancer, and more African American men have prostate issues and cancer. Sadly, African American males die from cancer more than any other ethnic group. African American women under 35 have 2 times the breast cancer rate and a 42% higher death rate than Caucasian women of the same age. These trends are exacerbated by poor access to care. Without early referral to cancer treatments like chemotherapy, the disease progresses faster, causing more complications and higher death rates. African American young women are 3 times more likely to die from breast cancer than Caucasian young women. 4. Diabetes. African Americans are almost twice as likely to be diagnosed with diabetes, also known as high blood sugar, compared to non-Hispanic whites. This makes diabetes, also known as high blood sugar, another area of concern for African Americans. In addition, African Americans have a higher risk of developing diabetes-related complications, such as kidney disease that progresses to end stage and amputations of lower extremities. 5. Stroke. African Americans are disproportionately affected by vascular diseases, which include conditions that affect both your arteries and veins. African Americans suffer from strokes at younger ages and at higher rates than people of any other racial group. Regrettably, they have a mortality rate that is 2 times higher than that of Caucasians as a result of having stroke, and if they do survive a stroke, they have a greater chance of becoming disabled and having trouble with their day-to-day activities. High blood pressure, diabetes, sickle cell anemia, smoking, and obesity are all conditions that are prevalent among African Americans. However, the reasons for this disparity are not entirely clear. Risk factors for stroke include all of these conditions. 6. Peripheral artery disease. Peripheral artery disease, also known as PAD, is a condition that affects 1 in every 20 people in the United States who are over the age of 50. PAD occurs when your arteries become clogged with fatty deposits that can limit circulation. African Americans in the United States have a significantly higher prevalence of PAD than members of any other racial or ethnic group in the country. As was mentioned earlier, African Americans have a higher prevalence rate of conditions that increase the risk of developing PAD, such as diabetes and hypertension. The risk of developing PAD is increased by conditions such as these, which are more prevalent in African Americans. Your risk of having a heart attack or a stroke is increased if you have PAD. 7. Sickle cell disease. Sickle cell disease, an inherited red blood cell disorder, affects only a small percentage of Americans. African Americans are more likely than white Americans to contract the disease. According to the National Institutes of Health, Over 90,000 Americans have it. Small blood vessels oxygenate healthy round red blood cells. These sickle-shaped cells become sticky and hard in sickle cell disease. Sickle cells die faster, causing red blood cell shortages, anemia. Sickle cells block blood vessels. This can cause weakness, pain, infection, kidney disease, stroke, and acute chest syndrome, a life-threatening condition with fever, chest pain, and breathing issues. Sickle cell disease cuts lifespan by 30 years. A bone marrow or stem cell transplant can cure sickle cell disease. These stem cells create healthy bone marrow cells. Risky, expensive, and painful transplants. Better treatments need funding and research. Research on this disease is scarce. What do you think of our video? Let me know in the comment section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching!